Okay, to get started, I just want to talk very briefly about NACD's history with sound therapy, so you kind of have a better idea of where this program is coming from. NACD has been involved in the field of sound therapy for many, many years, pretty much as long as it's been around. So, in the early days, Bob Doman had clients traveling to France to do the Tomatis method when nothing else actually existed over here in the US yet. And so from there, we have used the Berard method, we've used Simona sound therapy. And then in 1998, NACD put together the development team that actually created the original TLP, the listening program, which we still use today. So it's within this context of just vast experience of using sound therapy with, over 1,000 kids that TSI has developed. So we really, if we haven't used a program ourselves, we have probably had one of our clients use it at some point, or we've checked it out to some degree. So we're really familiar with what's out there, know a lot about what works and what doesn't. And so we're very pleased to be able to be a part of furthering the field and add things that really enhance what's there and take it a step farther. So TSI focused attention. I mentioned, it's really about figure ground processing. And if this is not something you're familiar with, auditory figure ground processing really is simply listening and attending in background noise. So figure is a reference to whatever the specific auditory input is that you need to be attending to. And the ground refers to the backdrop of sound, so the background. So figure ground processing. And, this is very significant because we're never hearing just in isolation. Unless you're sitting in a sound booth, there are always sounds in your environment. And, for typical kids and typical adults, we kind of have that filtering mechanism present that allows us still to tune in to one specific stimulus, even though there are other things going on. But for so many of our kids, and for a lot of adults, they just can't do that. It's like that filtering mechanism is not present. And so we really have to train that. And so I would really think about it in terms of specific versus random. So what we're trying to train is attention to a specific stimulus and being able to filter out and not be distracted by the random sounds. So this really is what it comes down to. And I like to think of it in terms of the specific versus random, even more so than just the figure ground processing, because there are some applications for the program that kind of go beyond just, kids who can't attend in a classroom. So, the significance of figure ground processing, or, the focused attention as we're calling it, is huge. Whether you're a child sitting in a classroom, an adult in a busy office, or, how many times have you sat in a restaurant and started listening to the conversation at the neighboring table instead of listening to the person, across the table from you? Well, maybe it was more interesting what they were saying at the table next to you. But anyway, you get the idea. When you're in an environment with lots of other noise and lots of activity, it makes it much more challenging to focus in on a specific stimulus. So there are just countless examples of where this applies every day, basically all day long. And, a lot of I'm sure, are seeing kids who tend to have hypersensitive hearing. They're hypersensitive to noise and all kinds of environmental sounds. And in that case, it makes this whole process of being able to focus and attend to whatever the specific input is even more difficult. So, who is this program appropriate for? In terms of ages, it really can apply to all ages. The musical content of the program is something that would appeal to adults as well as children. It's all instrumental, and it's really kind of a variety of melodies. There's not one particular feel to it. So anybody could listen to it. The only consideration when it comes to age is just that it does need to be done with headphones. And so in general, we find that kids younger than 3 have a hard time with headphones. Some 2-year-olds are ready to wear headphones. Of course, you have to be very careful about volume in that case, and it can be challenging just to get the headphones to stay on because of size. But in general, 3 is probably about the lower end of the limit just because of the headphone issue. Okay, so within this kind of unlimited age group, anybody who has trouble attending and listening when background sound is present could benefit from using this program. There does not have to be a specific label or category or group that you fall into in order for this to be appropriate for you. So if that's something that you have trouble with, if that's an issue for you, then this program might be beneficial to you. Of course, there are some kids and adults. Usually I'm just going to refer to kids because probably most of us are working with kids, but just know that, this is just as appropriate for adults as well. So some groups are obviously more at risk for having difficulty in this area. And some kids, for example, with attention deficit, it's just really hard for them to tune in. And so they would be an appropriate group for the program. Kids who, can't stay focused, they're very distractible. Kids who are hyposensitive to sound, now this is kind of an interesting group that we've expanded our usage to because it's also appropriate for kids who are hypersensitive. But kids who are hyposensitive, where they're really not tuned in at all, they're not aware of the sounds in their environment, including their parents saying their name. So we're talking about low functioning kids who really just are not processing at all. And this really has been effective in kind of waking up their auditory system in a way, making them more aware. And again, it comes back to that specific versus random thing, picking out the specific input that they need to be listening to rather than everything just kind of being, a sea of random noise where they can't pick out anything in particular. And that'll make more sense to you when I talk about listening techniques and how we actually implement this, why it is a training process in terms of training auditory attention. So kids who are hyposensitive can benefit. Kids who are hypersensitive to sound, what we have found is that this really helps to desensitize them to all the background sounds. So it, either end of the spectrum, this can certainly help. As I mentioned, children with ADD or ADHD, LD, learning disabilities, often there's some attention components there as well. Individuals with hearing loss, and this includes older adults who have hearing loss just due to aging. One thing that they find very difficult is figure ground processing. Even if it's a mild hearing loss, they find that when they're in noisy environments, it's just a lot harder to attend and pick out what's being said. So that is certainly a group that could benefit. Of course, kids who have a formal diagnosis of auditory processing disorder, or who have auditory processing problems, figure ground processing is very likely to be a part of that whole picture. Children on the autism spectrum certainly can fall into this group of candidacy. Children with Down syndrome, and also, this is a group that maybe you haven't thought specifically about before, but when I mention it, you're gonna think of specific kids that you've worked with who definitely fall into this group. Kids who just need to be more present. For whatever reason, they are just in their own heads all the time, whether it's, just lots of fantasy play, or, just kind of zoning out. But kids who need to be more present, this, idea of focused attention is critical for them.